World Suicide Prevention Day is a really special day. It's quite an emotional day for many, but it's an important day where we bring the conversation about suicide out of the darkness and shine the light. It's a day where we remember those that we've lost to suicide, those that live with ideation day in, day out, and those that love and care for people living with those thoughts. We also acknowledge the incredible workforce working tirelessly to bring down that rate, bring down the distress, and bring well-being to all. There's so many elements that feed into why someone lives with suicidal thoughts. But really it is something that if we intervene early, we can change the course, we can change the thinking. The National Mental Health Commission, we have been working with communities right across Australia to understand what the issues are, to bring a whole of government approach to the work that's done. Working in our schools, in our workplaces, in our healthcare settings, to improve the outcomes for so many people. The idea of suicide sits with too many people in this country. Sadly, while we have a very high suicide rate, many more people attempt suicide every day. We need to understand what's going on through better investment in research, to understand what might work and how to help people. Different things will help in different ways. If people do need help, there are many incredible resources available, whether it's talking to friends in the community, whether it's accessing support through your GP, through employee assistance programs, or online. Services provided by Lifeline, Kids Helpline, for example, the Suicide Line, all freely available to all of us, 24/7, no judgment at all, and often confidential services. What we know is the more we can, as a country and as a community and as a family, have a conversation about suicide, particularly with people we're worried about, we can open that door, open that box and begin a recovery journey. It's a safe conversation to have. You can talk about it, and it's important that we do talk about it. If you're worried about someone, ask them. You don't need to be a psychiatrist, a doctor, a nurse. You just need to be there to sit with them and hold that space with them until help arrives, or you can negotiate some kind of journey to help with them. But please know that that is a safe thing to do and a really important thing to do. At the highest levels of government, from our Prime Minister down, across the Cabinet, they are all working to understand where their portfolio responsibilities impact on suicide. This is a real shift in the mentality of our public policy, and we are embracing it at the Commission to work with Christine Morgan to collectively bring that rate down, to tackle it and work towards zero. So on World Suicide Prevention Day, take a moment to remember, to reflect and commit to a positive outcome in the future. Thank you.